Good morning. A very warm welcome to everybody who's listening to this LinkedIn live panel discussion to celebrate International Women's Day. I have excellent panel members here, which who will introduce themselves in a bit. I am Saira. I'm one of the interventional radiology consultants in Hull and chair of Equality, Diversity, Inclusivity Committee of British Society of Interventional Radiology. So thank you very much for whoever's joining us. Before we start, it's a live session, so a great opportunities to whoever's listening to ask questions and give us comments to clear your doubts. Any female out there who are interested in choosing interventional radiology as a career. So before we start, obviously, we need introductions. We have very familiar faces here. Majority of you will know them. But we just need formal introduction. So each one of you, if you can introduce yourself, and also I know you all have a lot of great achievements, but one or two maximum achievements that you're very proud of. So we'll start off with Prof. Watt.
Thank you, Sarah. Good morning, everyone. And it is a Saturday morning, and a big hug to all of you that have dialed in to take part in this event. I'm Ziwa. I'm a professor of interventional radiology based in Leeds. My interest is actually in interventional oncology. And some of you would know I wear multiple hats. So a couple of my leadership role is the chair for the faculty board as well as the council board at the Royal College of Radiologists. And I'm also currently the BSIR secretary. And I'm most passionate about encouraging more women into IR. And also I'm a great advocate of practicing evidence-based medicine. So today I'm a clinical academic with 50-50% splits between clinical and academia. It's been a long road to get here. Thank you.
Amazing. Claire.
Thank you. Hi, good morning. My name is Claire Maxon. I'm a radiographer by background of over 30 years, and but most of my clinical time was spent in interventional radiology. My current role is a quality, safety and improvement lead for imaging at University Hospitals of Leicester. I'm also on the committee, special interest committee for nurses and radiographers, and have been for 5 or 6 years, which is a great committee to be part of. My work in IR has led me down the quality and safety route, and I think my biggest achievements with that is that I completed an MSc in quality and safety in healthcare, which was absolutely excellent course, and that just consolidated all my experience to where I am now, really. And in other achievements, I think across my career, 4 or 5 years ago, we opened a new department, a brand new 3-room department on a different site, and had to go live, literally on the flip of a switch, transferring services and patients. So it was about 8 years in the making, from the initial design right up to that first patient. So, and it's still running well now. So I'm very proud of that.
Thank you.
Looking forward to sharing some of our experiences this morning. Thank you.
Jade.
Good morning, everyone. I'm Jade. I'm an interventional radiology registrar, ST5 at Adam Brooks in Cambridge. And I guess a few of my achievements today is the charity work and that side that I do. So I founded an organisation called Widening Participation Medics Network to help encourage people from underrepresented groups into medicine throughout medical school, and then help support once they become a doctor as well. And that finally got official charity status just this month. So that's been one of my biggest achievements. And then I think getting into interventional radiology itself after all the hurdles before that, I think that was a huge achievement for me. So I think there's a few, and I think we'll discuss a few more as we go through this today.
Fantastic. Thank you very much, all of you. That was a great introduction. So we don't have any questions or comments so far. So we're going to kick off by a few topics that are in my mind, and obviously they're hot topics that everybody wants to know your opinion. So, Z, my first question to you, obviously, gender disparity and underrepresentation is a big problem, especially, in interventional radiology. And looking at other specialties, surgical specialties, if you take, and I've been, looking at the percentage of female consultants in them, and, general surgery, for example, have nearly 40% females. Plastic surgery is close, pediatric surgery 35%. And as you're aware, you were part of some of the European surveys yourself, and BSIR and RCR have done some surveys, and we found that women in IR consultants are only 10 to 11%. We know that there are some, there are some issues that, female trainees have raised, but what do you think the biggest hurdle for women is, and why is the reason for this disparity in IR as compared to other surgical specialties?
Thank you, Sarah, for the questions. I think we can reflect back into our journey that we can because traditionally it's a very male-dominated specialties, and there are very few female role models. And I always say to a lot of people that if you just wear a hat of a common population or public, I sort of trying to sort of paraphrase the environment. So, for example, if we go into the shops that only sell, male clothes, no woman will buy any clothes out from the shop. So go and have a look. They say fantastic fashion for the man, but this is not for me. And they left the shop without any purchase. Yeah. And then same for any environment we go to conferences or we go to a workplace. If the team is just dominated by men, you go in and have a look and you say, actually, I'm not sure I can fit in here. I'm not sure, I fit into this environment. And then you walk away, not joining a clinical discipline. I think that unless we can encourage more women into a clinical discipline for them to become a role model for the subsequent generation, no one will come along because it's just like shopping. You won't go into a shop for women to buy male clothes. It's just a very simple analogy. But one of my CMO that couples CMO price to in my teaching hospital, she's a pediatrician. She said that when she came out med school, and the first thing she did was she gone around the clinical disciplines, see which clinical disciplines have female doctors or consultants. And actually back in her time, the very few clinical disciplines even have female consultants. And the only one that she can find that she find aligned to is pediatrics, because pediatrics generally, I think probably more women in pediatrics than any other clinical discipline at the time. She said that's why she's chosen the clinical discipline. So it's a very simple thing. Sometimes the way we choose clinical disciplines is whether we can see, if you see a woman can do that job, we'll actually feel that actually maybe we can too. If you don't see any woman doing the job, the first thing you tell yourself is maybe a woman is not suitable for this job. Very simple way of trying to, understand the situations. I think that's why for a long time we haven't, no one before us had able pave the way. And then I think the fact that we are now here, and then it's very important. For example, for our supporting team, like people like Claire, working with consultant male and female, understanding actually there are some challenges that women face. Another thing is, this is the very thing, I'm sure that, Sarah, you have the same experience. When you're in a lab, women consultants get very treated differently from male consultants. Because people just don't understand that, even this very simple thing like authority grading, and it's very strange when a women consultant provided the same, not sort of authority grading command, but simple thing that, please can I have catheter, given the kind of order that is required to conduct the team safely to execute case. And if a woman say exactly the same as the male consultant said, the women consultant can be seen as aggressive, and then whilst the male consultant say the same order will come across as assertive. Until we can actually get past that kind of norming and forming team, it's very difficult for women come through. I think the surgeons are much more ahead of us. There are many more female role models. And actually the team that look after them actually also understand the dynamics of male and female consultant within the room. And I think this is a very difficult thing that we begin to talk about. I find very illuminating when we were at Cersei Women in Ireland and Alice Bannico led the sessions in last year. In Cersei, we have excellent consultants bringing a team of panel of women from different part of Europe and when they talk about the way they get treated in the room is very different from the male colleague, and that on its own is a barrier, because when you are very early on in your career, you can potentially, because you will find that how can you get treated differently in the lab compared to your male colleague, and you can actually, if you don't have a role mentors to actually guide you along and tell you that that's okay, you might actually think that, am I the problem? And then you might actually begin to think that, am I not good enough? Or am I not well respected? Or am I not supposed to be here? Should I choose an alternative way out of the lab? Because people find that, my approach is not right. But actually, if we can understand that this is not to help us to understand how other people see us, but actually when we talk about it openly, it also helps people who support us understand that we are up against a lot of challenges. And then it is this kind of thing. I think there are a host of barriers out there for us. Until we're brave enough, we're courageous enough to be able to stand on the stage, explain to people that, that it's not that easy to be a woman in the lab, in anywhere. But actually, until people understand our challenges to help us to overcome challenges, we are going to be navigating through this journey for a little while to come. And we definitely won't be hitting the 40% of general surgeons and but they have come a long way. So there's hope, because they managed to get there. We will get there. Just that there is a long road ahead for us.
Yeah. I think a few years ago, this wasn't even raised as an issue, isn't it? And I think, with the amazing leadership that we have right now, women for BSIR and all of you are doing amazing work in order to create this awareness and help, women out there who want to do interventional radiology. But as you said, you rightly put it in nice, simplest way possible, and absolutely beautifully. If you don't go to a shop, you don't see any females there. I wouldn't personally go there. If I'm thinking about specialty and all I see is men doing it, that wouldn't encourage me to do it. But I was exposed to it at a very young, early stage, and I absolutely fell in love with it. And that's why I just listened to myself. You filter out the outside voices, isn't it? And you just march on with whatever. And I think that's what we're all doing. And that's why we're here to celebrate all of you. So obviously, we'll talk about how to encourage and things to do, how to improve those things. But when we do these surveys, Jade, my next question is to you, because you're training in interventional radiology, and you're not just an ordinary trainee, are you? You're a gold star trainee. You've done so many things. You've achieved so many things at such an early stage, and I know that you're gonna do great things. So work-life balance and family responsibilities, obviously, when we go to a lot of conferences and female, junior colleagues in training approach me and say, how do you balance your work life? As a trainee, I know you're in early stages, but obviously you've done so much. What advice would you give to your junior colleagues? What is your secret?
I think when people ask me that question, I talk to them, I think a lot is realizing that it won't always be perfect. And there'll be stages through your career and in your life where you're going to have to prioritize work a bit more and prioritize the extra things a little bit more. And I think it's understanding that perfection is not what you're looking for, but it's at the right point and stage in your time what you're going to focus on, and having that support network around you that's going to help get you to where you want to be. And I think for me, balancing whether it's charity work or being BSIR chair or some of the work I do with the Royal College. It's deciding what I say yes to as well and what I say no to. Because before I was a yes person and I was like, oh, this is going to be a great opportunity. Of course I want to do that. That's going to be great. Of course I'm going to do that. Or sometimes I feel like that might not be a great opportunity, but I'm still going to do it because I was asked to do it. And I was just always a yes person. And it wasn't until a couple of years ago that I sat down and I was like, actually, I made a little PowerPoint presentation. Actually, it's going to sound very odd. And I had all the things I was doing on the PowerPoint slide and all the things I needed to do for each role. And I was like, what is giving me enjoyment? What do I feel like I can make an impact in? What can I feel like is going to help me evolve, but also I can actually help with what I have and what my abilities as well. And I think it's when I sort of streamlined that is when I became happier and able to balance things more, because then I had more time to put into what I enjoyed, but also more time to put into the hobbies, whether that was for me playing guitar or going to the gym or being out in the garden, enjoying going to Bristol, which is about a 4-hour door to door to see my family. So it was just thinking what for me is important in my life and how am I going to juggle that with work. And there will still be days in work that I love to stay back late and find out what's going to happen at the end of this case and see how the patient is after. So I will stay back for that. Or there might be this teaching opportunity on my day off and I might want to go in because I love teaching and I'm really passionate about teaching. So I went to with some medical students, and it was a great sort of realization for me how much I love teaching again, because they were doing ultrasound and it was the first time they'd held an ultrasound probe, so they were doing ultrasound on each other, and one of them saw the liver and then they saw the hepatic veins, and I was explaining the anatomy and someone was like, wow. And I just that enjoyment in their face, and I was just like, yeah, this is anatomy, it's great, and this is what we do and what we see, and then with the procedures I was talking about, and they got really excited. So I love that aspect of teaching and as well. So it's finding for me as well, I think another point is when things get too much, recognizing before you've gone too far and you're in that slump stage, and it's just being able to recognize the little things about yourself that might change, and that could be really subtle things. Maybe you become a little bit more snappy with those around you and the people that you love, and then you realize, actually, I need to take a step back, take a breath, and reorganize what my priorities are. And I think that's what sort of got me through, and that's been a learning stage. Haven't always got that right, but that's been how I've progressed, I think, and being able to do all of the different roles and things that I love and enjoy.
Yeah, absolutely. Excellently put, actually. I think at the initial stages of our career as well, it's you just want to do everything, isn't it? And I think it's just creating that balance and or striking that balance of what you really want to do. You just need to start learning to say no to certain things. And I think I always say that if you're happy in your career, you're happy in your personal life as well, and vice versa. So both of them are extremely important, and it's a challenge for any medic, I think, which we need to achieve. Z, do you have any comments on that?
I totally agree with Jade. You should put it beautifully, because life is a journey. Sometimes it takes a while to learn to say no, because you almost feel like I'm also a yes person. I think a lot of us are yes person. Women in general are yes person. That's why we find it quite difficult to navigate. And the most interesting is we probably have more role in the society in general. We become carer, we become mother, and then we just have so many hats we want to wear. And then sometimes I always say to people, when I look back at my journey, it's easier to give up and leak out the pipeline and then actually stay. So one of the things I learned, just like you say, when you're in the slump, be kind to yourself. Tell yourself it's okay to be in the slump for a while. And then even people are going to judge you, but there are a lot of people are not going to judge you. And then, and we are not going to be here to please everyone. But first and foremost, you need to be there for yourself first. You cannot be there for yourself. You cannot be there for your patient, for your loved one. You cannot be there for anyone. So you always have to learn the balance to be there for yourself and navigate a journey. And you will always find some support people around you. And then and these are the people that will form your forever network in that sense. And the people doesn't have to be immediately next to you. I think nowadays that's why we have all these events. So some people online or actually not will be able to reach out. I'm sure that people that we don't even know write to us after this event, and we will be very happy to connect with them, do signposts, them to the right place that need to be. So I think, yeah, Jay, you're absolutely spot on, and just as Cyrus said, you have done amazing thing, and then keep on going, and then you're such an inspiration for the younger generation. We are very proud of you.
Absolutely, yeah. We need more. We need to clone Jade. I think Claire is having some technical issues, so she's offline. Otherwise, I was going to ask, but we'll wait when she comes back. So let's talk about women in leadership role in IR. Obviously, the question is more towards Z, because you've obviously been in leadership roles in IR, and we know that the representation of women in IR is very less, let alone being a leader and to lead a team which is male dominating. Obviously, you would have faced the challenges. So what are the most difficult challenges that you faced when you were, obviously going for a leadership job? Were people around you encouraging, and how did you overcome them?
I think that most of us, especially women, we always we don't even need other people to discourage us. We often have this imposter syndrome. We just don't think that we're even good enough to go for it. So even when leadership positions are advertised in general, you find that women need somebody to ask them to apply for it. But actually, in general, men doesn't have that kind of, they do, but not to the degree that they need someone to persuade them. They will put themselves forward. So that is just, I think that's the genetic makeup of us. So that's why I think to be aware of this, that you help first to encourage each other. And then also it takes me a long time to find who I am and what drives me. So for all the people that are listening to this LinkedIn Streamline live event, there is Simon Sinek is a British tech talk leaders, and he talk about why, how, and what. It's very important to know who you are. If you can discover who you are and what drives you, that help you to land a leadership positions that is meaningful, that you can actually make an impact go forward. Just like Jay has nicely said that, the charity, the widening participation is one that, Jay, you helped me to understand who I am as I was journeying forward. I'm not kidding you. Up until the widening participations network was actually, created by you, launched by you, I personally did not even understand what widening participation means. So when the Royal College of Radiology published that article, when I go in and look at the criteria, what widening participation means, it created a dimension of me, because I know my road was so difficult. But until I look at the widening participation, I realized that I came from that background. English is not my first language. I'm the first graduate in my family, etc., etc., etc. So then it helped. In fact, it's very empowering, because given that I never knew I came from widening participation, but I am. But and then the fact that the road was so difficult, I got there in the end. It sort of empowered me and inspired me to be one who talk about it openly, to help others to come along. So it makes sense why it's difficult, because I came from widening participation background. It was never meant to be easy. And nowadays I tell people, I even tell my daughters and my trainees, anyone I met, I say to them, I suppose it's not worth doing if it's easy. It's only worth doing because it's so difficult, because at the end of that journey, you actually develop amazing resilient muscles. And then you can learn to laugh at it all and then inspire others. And some of the journey is very, very difficult. And then the best thing, if we can emerge through a journey, is to paraphrase our story, not to talk about the difficult thing, but if we can emerge through with strength, we can talk about our story in a way that can be inspiring to others. And that is That's something that I always say people, I'm in a reminiscent stage of my journey. I look back. I'm so glad that it's making sense to me. Even like, Jay, thank you for doing what you do, because it helped me to understand why it was so difficult, because I was always thinking, why does it have to be so difficult? But it was. But then the fact that I'm here to share my story in a paraphrase, some of the journey. I think it's inspiring that I'm not supposed to make it. The fact that I made it now and in various leadership position, it's an inspiration to others. So don't give up. Go for it. And then, always go for leadership position, because if this is something what you wanted to do, go for it. If you don't get it, at least you try. And then there's no regret, because regrets eats people away, but trying and failing is great. Because I say to people, when you look at anyone successful, you only see the tip of iceberg. The foundation of success are built by failures, heartache, sacrifices, and that's something that we don't talk about. But then if you understand what it requires to get to the tip of iceberg, and then it's okay. Then you realize that this is normal. And then, when you're in the places that you need some support, ask other people to lean in, to help you. Because there are a lot, as the world is very interesting, as much as some of the challenges in life, there are also many, many kind people who lean in, will lend you a hand and lift you up when you're drowning, literally. And so look out for them, seek people out. You will find when you seek them.
Absolutely, that's fantastically put. Claire, welcome back. Sorry, we lost you for a few minutes. We're talking about leadership roles. Obviously, you're radiographer from background. Obviously, the proportion of female radiographers is either equal or probably more than men. Is getting leadership roles in radiography easier for women? If not, are there any challenges? And what advice would you give to your junior colleagues?
Yeah, I don't think there are any. The only limit is yourself. Obviously, radiography is a more female dominant profession. Personally, I think it's very interesting listening to Z. That people, I'm quite later on in my career now, and people think you just get here by luck, and it isn't luck. It's a journey, and I've always taken every opportunity that's come my way, or you go looking for them, and it's served me well. And as Jade said, learning to say no, and choosing and balancing. In terms of leadership, it's available to across the board. I do think that there was comments earlier about women treated differently, and I think in leadership roles, I still think that is a thing. I've been sidelined if I'm sat next to a man or whatever, and I think it's always sometimes from outside of the NHS, contractors and etc. There's been many a time. I'm known to be very strong, and but again, you perceive to be a certain way because you have to be that way, but it can be seen as aggressive, and that's still a thing, which actually doing this webinar, has made me think about a bit more, because it's just something that's accepted, but because we don't have these conversations. But I guess that there isn't barriers as such, but there is still poor attitudes, and you still do get treated differently, I think, in some situations.
Yeah, I think that's a problem that I personally face on day-to-day level as well. And yeah, I mean, I totally agree with you. I think, personally, I think females can be good leaders because, we can multitask. It's the way we perceive, we look at problems, we deal with it differently. But I think in my humble opinion, I think there are three things that really undermine our confidence. Personally, for me, one, I think Z spoke about imposter syndrome. I think, and the second one would be in your inner critic. You just feel like you're not good enough, and there are other people around you who can do things better than you. And then perfectionism can be good for you, but it can be your biggest enemy as well. You just feel like, oh, if I can't do it right, I shouldn't do it, which is something that is more. These three things are more commonly found in women more than men. I think men kind of dive into it, even if they're, that's how we are. But these three things are common in women, but they can become our strength as well. It's the way we deal with things, the way we look at things, problem solving, and we should use it as our strength. I feel like I am literally feeling like an imposter right now, interviewing all of you three amazing ladies. But it's something that we just have to think about and actually accept it and work on. Claire, obviously, another very important aspect for women in IR is radiation exposure, and there's a lot of talk about it. In my personal experience, people, there are junior radiology registrars elsewhere, not just in my hospital. Some of them are completely discouraged to go into IR suites as soon as they find out that they're pregnant. I think the knowledge of radiation exposure is, I think there's ignorance. So and the supervisors, the educational supervisors, the clinical supervisors don't have enough knowledge, so they don't encourage their trainees as well. So can you briefly tell us about the radiation exposure and the risks associated with it? And my second question would be, obviously, talking about the physical challenges, so lead wearing in pregnancy, and how to overcome that. So if you can tell us about the radiation exposure and pregnancy, please.
Okay, so I was looking at this recently, thinking that we would be talking about it, and I actually was a little bit surprised that the regulations in place are exactly the same for a radiographer as they are for a radiologist, which in a way should make it evident that the risk is manageable, and the monitoring, obviously if you trigger the monitoring, which might be more possible with a radiologist compared to a radiographer, because obviously you can stand back. So in terms, I do agree that that level of expertise, I think people need that reassurance, don't they? That's the bottom line. I've worked clinically through 2 pregnancies. You do have the option to say, maybe be redeployed or step out, but my kids are sort of 14, 16. So back then, it wasn't really an option that anybody took. I'm seeing now a lot more nurses and radiographers, when they get pregnant, they don't want to, they step out. But it's just that's become more of an option, but it wasn't when I was, and I certainly, pregnancy is not an illness, is it? It's best, I was still doing on call at 24 weeks in the middle of the night. I'll never forget that, because the patient was more bothered about me than they were as to what was going on with them. But I think that was me and my attitude. Some people, haven't got the same beliefs, or they have different concerns. So I have seen a shift where people are stepping out a lot later. I think radiation safety is very much a specialism in its own right, and I don't think that I think there's a gap there where those conversations aren't had, or I did some quick reading as to what's available out there, and it's not very reassuring, even though I know it's okay, but that's because I'm a radiographer. But you were reading that thinking of coming in, or you're already in radiology and become pregnant. I don't think it would give you a lot of allay your concerns. So I think there is a piece of work there in getting people in finding the experts, and having those conversations to reassure people. And then everything is risk assessed, and there's all the different risk assessments for pregnancy, which are thorough, and it is there to protect. And then you have to do it on a case-by-case basis, really, because it gets to a point where there's no lead apron that's going to fit you, but your shape and size and how your pregnancy develops is something that's not known. So you do have to take it on a step-by-step, case-by-case basis, and then obviously the complications that can occur in pregnancy as well. So it is an individual per staff experience. I mean, there's not a general rules. It is tailored around that individual.
Yeah, so I suppose what you're saying is obviously it's a personal choice, and it's everybody should be treated on an individual basis, but there's no evidence to suggest that radiation causes any harm to the fetus. I mean, there's very little exposure, and obviously in some departments, I know in R as well, so pregnant, you're given they obviously do your assessment of your job, your out of hours or on-call commitments, and they estimate how much radiation you're going to be exposed to and calculate that. And obviously they can calculate if there's any risk to the, and we were also given a TLDs or live monitoring. So when we're wearing that on top of our lead, so if you're close to, obviously you're live, there's a screen on which you can see how much radiation, whether you're in green, yellow or red zone, and you can obviously step back when there's angiographies happening and you don't need to stand next to the patient, and with all the protection and stuff, I think it's pretty safe. I mean, I've only got one child, and I was a consultant, obviously a new consultant, in my first year, very anxious. So I, in a department which I had all male colleagues, so I had to prove myself. I could have done things differently looking back, but it didn't. So obviously there was extended hours, and you scrub more because it's a steep learning curve in the first year of your consulting. But I don't think I would have done anything differently. It was just at the stage of my career, and that I was just exposed to more radiation. Z, I mean, you've got two gorgeous daughters. Would you add anything to it? How was your experience being pregnant and working in IR labs?
So I was just going to say that during my time, it's a very challenging thing, because just like you, Sarah, when you are going to be the first one to be pregnant and as an IR in a department, it's going to be challenging, because the good thing is we do know now today that the radiation exposures in a well control, if you wear the light correctly, if you look up the dose correctly, the radiation exposure is not really the kind of radiation exposures that people worry about. Is minimal. But it's more important is the perception and misconceptions. So I remember that as soon as, I was in denial. Literally, when I was like, when I can't even see my feet, people say to me, "Z, you're pregnant." I say, "No, I'm not," because this is the hardest thing, because the moment that people realize pregnant, they start taking my job away. They almost tell me that it's not safe for me to be in a lab, and I'm the one to convince my male colleague it's okay. It is, I'm safe, and I double like myself at the time, because because I wanted to be in the lab, and it was a very difficult journey, because you at that time, because there's so few people you can go to even talk about this kind of thing. There's no role model, and then whilst I think my male colleagues are very protective, and I think that they came from a place of caring, but actually on the other hand, you don't know how to feel about this, because literally they ask you not to be in a lab, and then if you are not going to be in a lab for a year before during the pregnancy, and you are going to go off for a period of time, then you are literally 2 years out. And then 2 years out, as we say, a lot of trainees have 2 years of our training, but you're 2 years out, you'll be significantly skilled, and a lot of people, that's why women never come back, they leaked out the pipeline. So I was very conscious and of that, and because it was the first one, and then because long before I finish my training, become IR consultant, I wanted to be trained as an IR, as a trainee. I was persuaded. People are kind around me because they genuinely care about my well-being. They say, you want to have a family, you don't want to become an IR, it's not good for work-life balance, and the radiation, and to be fair, a lot of trainees, the moment they become female trained, the moment they're pregnant, they left the lab and they never returned. And that was a thing, basically. And then so I decided that, that's my passion. I wanted to do this, but I wanted to be safe because I don't want to harm my child, So I make sure that I make sure that I wear my, I have my radiation protections on, and I work well into, throughout the, to my trimester. I want to be safe. I wanted to pave the way for women after me, if that is possible, because to be honest, I wasn't sure how I'm going to return, because all my male colleagues tell me no women return after pregnancy up until that point. No. So it's really difficult because it's not that they don't trust. They have trained many women in IR before. They all left after pregnancy. That's what they say. You say no women return. You say what makes me special compared to them, because they're all equally talented. They just do not return. So what makes me special? So I was building up in fact interventional oncology program at the time. And I have to make a very difficult decisions. If I walk away for a year, my program will have collapsed because in the infancy. So I came back from Harvard and I was building a program. So I make very difficult decisions. So a lot of people knew that in my department, and it's something that I openly even share, even in my NIH fellowship application, for each child, I have 1 month off.
Oh, wow.
Okay. Today, my daughters are 18 and 16. One is in university in UCL, and it was really interesting when we're growing up. I remember that when you're in the lab, the girls at school, they finish at 3 o'clock. I mean, wish I have female IR. We're in the lab in the middle of procedure, 3 o'clock, like school finish. Any one of us leave, even you will not even job plan to finish at 3 o'clock to pick up. I mean, we would in general, because it's really difficult conversation. If we wanted, today things are changing. People are more flexible. Back then, flexible working is not a thing. Okay. If people will look at you on flexible working, you are not a team player, you're out. So it is a very difficult thing. So some of us, I'm so glad that we paved the way for future generations, because when there are more of us, it means that our voice will be heard. If there are none of us, nobody can see our perspective. Even, we are the disruptive change, hopefully in a constructive way, to pave the way for a subsequent generation. So so when I have another female colleague came through in the pipeline, she wanted to also emulate my thing. I said, don't. I said, take 12 months off. I said, because you are not the first one. When you are first one, you have to prove a point, because people don't believe that we can even come. So I came back, I persevered, and it was difficult, because when you come back, people always are conscious that whether you have a baby head, that you cannot do any procedures. I have my colleagues so protected that they follow me around to make sure that I'm okay, and I'm glad. I know in many ways, sometimes it's great to have people wanting to care, but sometimes they also have to understand the boundaries of caring, because some of us, it is difficult to return, because you do feel, not only we all have imposter syndrome, but you've been out of your work environment. You want people to be supportive, but supportive in a way that is meaningful, not to sort of even support and undermine at the same time. And that is a balance. I think women are better at that balance.
Yes.
I think that actually is the difficult thing. It's not something we're going to match when people teach us, in that sense. But women intrinsically, it almost linked in with EQ. But, not to say that, people have to be born with it, but if we can talk about openly, we can begin to see the perspective, the understanding, and this is not to blame or judge. And then, I always say that the fact that I'm here today, it means that I'm meant to be here. I'm meant to be here. And people know that a lot. I've gone for leadership training. I'm a storyteller. I love telling story. And I like to think I paraphrase the story in an inspiring way rather in a way that trying to, shifting blame and things like that. But it is important for people to hear it, people understand it, because the future is really bright. It's okay for it to be difficult back then, but for us to pave the way for the future. So it was never straightforward. It was actually very tricky, but we iterate through the journey. And radiation was a big thing because I had this fear for a long time that was thinking that what if I cause harm decades later to my children? Not until I met the medical physicist from Nottingham University. In fact, we wrote a piece for Royal College of Radiology, and he reassured me there's no dose, minimal, don't worry about it. And then only then, actually decades later, I felt okay about it. And actually, I was asking my daughters to not spend a lot of time with her. And actually, only last year she gone to university. I asked her, have you missed not having mommy? Because when she was growing up, I always tell her the concept. It's better to have quality mommy than a quantity mommy. And then she used to make me feel really bad not to be a school gate mom. And then when she wanted to play with her friends on the field, she would say to me, Mom, I want to play. She said, you're never around. And then I have to take annual leave so that I can pick her at 3 o'clock to be there watching her play with friends on the field. And then, so last year I asked her and she smiled, smile from cheek to cheek. She says to me, Mom, no, I didn't. It's okay. She said, actually it hasn't caused her anything grief at all. But she said she probably made me feel more guilty than anything else. And she was smiling away. I thought, it's great to know. It's great to know. So I think that it is something that we can look back and understand what it means. But at that particular time, a lot of us, I think especially women, because we're so much responsibility, we have been guilt tripping by everybody around us. So the moral story is find a friend to speak to. You really feel really guilty about people guilt tripping you, because actually when you talk to some of us, it's okay. We've all been there. And then, it's not going to affect anyone. But so long you understand how you prioritize the thing at that moment, just like Jade said, sometimes you do have to prioritize work at that moment in time, and sometimes prioritize family. But it's a journey. It's a learning thing,
I mean, and if we have inspiring, people like you who've gone through all this, done it all, and you've come out, shining, obviously that's very encouraging. And I think that's why we're here, to let all the women out there know that, it is, a lot of it are just misconceptions, and, and we obviously need to work towards that. We've already started that. I mean, I've got one comment. Vijaya Arshad, she's one of our pediatric intervention radiology colleagues in Hull, very competent. She says, completely agree with this. More constructive, disruptive change is needed. And I'm sure we all agree with that. Mom guilt is the worst, but we never hear of dad guilt. But how nice to know it's more in our heads. That's so true, Heather. Comment by Heather. Yeah, I mean, we always feel guilty even if we're there. It's guilt about not being on time, being late, not fully mentally being there. It's just guilt. And I think, with all these examples and sharing your experiences and how you've all done, and are still, working towards making things better for our future generation is absolutely, very encouraging to hear. So, Jade, mentorship, obviously all of these, we have all these issues, and the majority of them, as we've all said, yes, the challenges are there. We're not saying that, it's absolutely, a nice path full of roses and we just have to, the challenges are there, but there are a lot of misconceptions as well. And I think there are lack of female role models in intervention radiology, I feel. Do you agree with that? Do you think, how important is mentorship? Do we have enough mentors? And what can we do to improve that?
I think mentorship is so, so important. And I think lots of us have maybe had informal mentors through the journey, and some of us had more formal mentorship. But it's building that relationship over time with someone that you can talk to, that you trust, and you can bounce your ideas off of, and just someone that can give you a different perspective as well, and maybe share parts of their journey. And it's not that you're going to follow in their exact footsteps, but it's understanding their journey and how that, or different points of that, can actually help you figure out your own journey. And I think mentorship helps you also network with other people and meet people that you haven't met before. And it's a great opportunity to take the career path that you want with someone there that can reflect on different parts of your experience and can help build. And I think depending on what stage of your career you're at, I think it can always be helpful to find someone. And even recently, I just emailed someone. It's like, I need a mentor. I've got to this place. I really need a mentor. Would you be happy to mentor me? And I think don't be afraid in reaching out. They may be too busy at that point in time and say no, but they might be able to help with a specific part. But it's okay to reach out to people. And then there's the new schemes like BSIR mentoring that you can sign up for more of a formal sort of year mentorship as well. But I think it's sometimes we want to do it all ourselves and we feel like, oh, okay, I can do it. But I think sometimes you really just need to let other people in and support you with that part of your journey. And I get lots of random questions from, especially from female medical students or female radiology trainees, and it reflects in the previous conversation. A lot of it is about pregnancy, and I didn't know the answers beforehand. About a year ago, I wasn't really sure. I was like, I don't know if you continue with and it's fine, or if you have to take a break. I don't really know. So I had to like look into that myself. And I was like, but why wasn't I provided this when I started radiology? Why wasn't that sort of obvious to me? I was like, I should have known these answers to the questions. So I think there is some work to do there. But I think again, mentors can help sort of bring you to a different person or within their network that can help answer some of the specific questions you have, because some people haven't felt comfortable within the departments they're on to say, oh, I'm thinking about getting pregnant, what's the next steps, how would this work? So I think mentorship can also help that side of things as well. But I think for me, I've had lots of different mentors throughout the journey, and it's helped both informal and formal, lots of different steps of the way. So it's just allowing people in and building that mentoring relationship well, and that can then have the outcome hopefully that you want.
Yeah. And there are, as you mentioned, there are some mentorship programs out there, fantastic mentorship program, isn't it? So there's GradReach, BSIR started their own mentorship program, and I think RCR are doing a mentorship program. So yeah, very important. I think most of the problems, I mean, that I had when I was training is obviously we didn't have mentorship, but then everybody's different. You kind of feel that, some people feel as if their problems are unique and probably just, their problems, and maybe nobody will understand. You kind of just fight through them and you don't talk. But over the time, I've learned as well, communication is very, very important. Having mentorship and having that person in your, to help you with your career journey is very important. And it's very important to find out that you're not alone. I think sometimes you can, at any stage, it can be any stage, you do come at a stage where you feel like, oh, it's probably just happening to me. Am I in a unique situation? But you need to communicate, talk to people, and you'll find out that actually, there are a lot of people out there, regardless of which specialty they do feel that. Z, do you have anything to add on to that before we move on to our next topic?
Yeah, just quickly, mentorship. I think you need mentor throughout your career, even at this stage. When applying for my NIHR research fellowships, and one of the things that I was advised to actually have an executive mentor. So nowadays I have one. It's very important for people to signpost you, and very important for people that are independent to actually continue for you to actually achieve goals in your career. And so I advise everyone to have a mentor. You haven't had one, trying to find like a coach or mentors, and it's very, very helpful for personal and professional learning. And life is actually technical lifelong learning. We're not supposed to stay still. We're always supposed to grow. So, I totally agree. definitely. You haven't got one, go and find yourself one now after you leave this event.
Absolutely. So, comment from Catherine Lewis, happy to be a mentor. She's an IR consultant for 10 years. I've signed up for the RCR program and also happy for people to informally. So thank you, Catherine. I think we need lots of women, but not just women. I think we can have male mentors as well. I've had male mentors throughout my career, and it's been absolutely fantastic in encouraging me. But we need more female role models as well and mentors. Heather has said that BSIR mentorship program is launching. The mentor applications will open on the 15th of May and Menti open mid-June, and ready to start in summer. Obviously, we've only got 5 more minutes, and I've still got so many things to talk about, and I'm sure we've not covered a lot of things. Before I move on to the last one, obviously, we just need to touch on the less than full-time training. Obviously, it wasn't something that was there, but nowadays becoming popular in other medical specialties. And just to say that, yes, RCR and Health Education England encourage radiologists and IR trainees to, take up less than full-time training, if it suits their personal life, and just create that good work-life balance. Anybody has any comment on that? Less than full-time training?
I think I've known sort of several trainees that have taken up to 10 years to do their training, including the diagnostic and interventional radiology training, and they've seen more cases, they've been around for more, and they're excellent consultants. And I think there's not necessarily a rush to become a consultant. It's a journey where we're learning as we go, and there's so much experience to be gained as a trainee. So I think for me, sort of halfway through my training, I'm still like, training is excellent, because when I become a consultant, it's going to be a lot more independent, and it's great learning from all my peers, seeing lots of different ways of doing things. And I think not putting yourself on the same, like, oh, I have to achieve this in this time because that's what most people do. I think just find your own journey and you'll be competent, and that's the main thing, and you'll be happy in your career. That's another key thing. So I think for me, it's like, if you need to go part-time or you want to, why not?
Absolutely.
I totally agree with it. Just want to say, dance with your own rhythm.
Yeah, absolutely.
Just on the opposite side of that, I think within radiography there isn't that structure, and you find your own way, but you also then find your own role models. There's the higher up you go, the less support you get, and you're expected, because you're a band 8, or you just have to get on with it, and you actually get less support the higher you go. But you find that by that stage you find your role models, you find the people that you want to be, you aspire to be, because you understand the qualities that they've got. But there certainly is nothing structured, and whether that needs structure, I'm not sure.
Yeah.
Okay, can I come back to that, Claire? If anyone listening into this, I mean, Claire, whilst there's no structure training leadership, NHS Leadership Academy has multiple level of leadership training. You can start with Edward Jenner, Mary Seco, Elizabeth Garrett Anderson, and Nia Barron. I think there are different other besides this 4 level. So the Edward Jenner ones online, I did one of them. It is Elizabeth Garrett Anderson. I find very useful because I learned a lot of things. I read a lot of things that would not normally have read as a conventional diagnostic interventional radiologist. So look out for it. Just Google it and find it's on NHS Leadership Academy. There are some courses. All the organizations sign up to it. They should support you, regardless of what background you are, whether allied healthcare, doctors, or management, because actually courses are designed largely for leadership in management. But anyone can sign up to our NHS organizations to support it, because there are a lot of learning and very, very interesting.
Fantastic. Thank you very much. 30 seconds. Is IR a rewarding career? Just quick comments.
100%. I've for 3/4 of my career has all been in IR. I wouldn't work anywhere else. I think what we do and the team and what we provide and the feedback we get from patients is second to none, and it's so rewarding, and the differences we make to our patients every day, and I never forget that.
Absolutely. Z.
Totally agree, 100%. Never look back. And if I'm here, I love to see more men and women who come into IR, and I'm very excited for the future generation.
Jade.
Yeah, I love my job, and I'm persuading sort of all the medical students I come across and just introducing them to interventional radiology as an amazing career. So definitely, my short answer is yes.
Yeah. Right. I can't agree with all you enough. Well, thank you very much. I can't thank you all enough. And everybody who's been listening to us and participating in the chat, giving very encouraging comments. As Z said, it's a Saturday morning, bright and sunny, and all of us are here working towards this cause. Hopefully this has made a difference. It's another step towards a long journey. But thank you very much for sharing your experiences. Thank you. So we end our panel discussion here.